Okay, get ready, because today we're taking a deep dive into something that most people don't really think about, but it impacts a surprising number of people.
Yeah.
Corneal dystrophies.
Definitely a fascinating area to explore, for sure.
Right. I mean, we're talking about the cornea, that clear outer layer of the eye, and you've brought us some medical text to really unpack exactly what corneal dystrophies are and what they mean for the people who have them.
Yeah, happy to help shed some light on it.
This is already where I get that, wait, what?
Mm.
Feeling, because honestly, when I think about vision problems, I usually go straight to needing glasses, not something actually being off with, like the structure of my eye.
That's a really common thing to think, actually.
Is it?
Yeah, but think of it this way. The cornea is like a window to your eye, right?
Yep.
And like any window, it's got multiple layers, and each one has a very specific job to do.
Okay, break down this window for me a little bit.
Sure.
What kind of layers are we talking?
Well, if we're going to get a little technical, the cornea actually has 5 distinct layers.
Oh, wow.
Yeah, there's the epithelium on the outside, which basically acts like a protective barrier.
Okay.
You've got Bowman's membrane, which is another layer of defense.
Mark?
The thickest part is called the stroma, and that's what provides the strength and the shape of your eye.
Oh, okay.
Underneath that, you've got Descemet's membrane, thin, but surprisingly tough.
Really?
And then finally, the innermost layer is called the endothelium, and this acts kind of like a pump, keeping the cornea clear by removing excess fluid.
5 layers. That's way more complex than I ever imagined.
There's a lot going on in there.
It is. But here's where it gets really interesting to me. And I'm guessing this is why there are so many different types of corneal dystrophies, because each of these layers can be affected differently, right?
Exactly. You hit the nail on the head.
Did I?
Yeah, each layer has its own, like, vulnerabilities.
Okay.
And when one of them isn't working properly, you get a very specific type of corneal dystrophy with its own set of challenges.
Okay, so it's not just one thing going wrong. It's like this whole domino effect,
Probably.
depending on the layer.
Exactly.
That makes sense, but it also makes my head spin a little bit thinking about all the different ways things can go off the rails.
Yeah, it's a lot to take in.
It is.
But don't worry, we'll unpack it.
Okay.
The good news is that even though there are a lot of different types of corneal dystrophies, we can group them into 3 main categories based on which layer of the cornea is, like, mainly affected.
All right, categories are good.
Yes.
Give you the categories.
Uh-huh.
Categories are good.
Yes.
Give you the categories.
All right, so we've got anterior corneal dystrophies, and these are the ones that affect those front layers, like the epithelium and Bowman's membrane we talked about.
Right, because those are the layers that kind of take the first hit from the outside world.
Exactly.
Makes sense that they'd have their own set of problems then.
And then moving inward, we have stromal corneal dystrophies.
Okay.
These ones affect that thick middle layer, the stroma.
That's the one that gives the cornea its strength, right?
Yep, that's the one.
So I imagine problems there could be pretty serious.
Yeah, stromal dystrophies can be a bit trickier because they can sometimes affect those neighboring layers too, like the Descemet's membrane or even the endothelium.
It's like that domino effect we were talking about.
Exactly.
One malfunctioning layer throws off the whole system.
Yep.
Okay, so we've got anterior stromal.
Mhm.
What about that final category?
Our last category is posterior corneal dystrophies, and these affect the back layers, so the endothelium and Descemet's membrane.
Got it.
Anterior, stromal, posterior.
Our corneal layers. Organized.
Organized.
I like it. But you mentioned that there are these like specific types within each category.
Right.
And your research actually highlighted one in particular, right? Fuchs dystrophy.
Yes, Fuchs dystrophy is a really good example of a posterior corneal dystrophy.
Okay.
And it shows just how important that innermost layer, that endothelium, really is.
Okay, so walk me through it. What happens with Fuchs dystrophy?
So remember how we talked about the endothelium acting like a pump?
Yep, keeping the cornea clear.
Right. Well, with Fuchs dystrophy, that pumping action starts to fail.
Oh, no.
Yeah, so the endothelium can't clear fluid from the cornea as efficiently, and it causes this buildup that leads to swelling and blurred vision.
So it's like the cornea's drainage system gets backed up.
Basically.
Not good, not good. You also mentioned keratoconus in the research you sent over.
Yes.
And that one really caught my eye.
Yes.
Pardon the pun, but it's actually more common than Fuchs, right?
It is. It is.
Oh,
Keratoconus is actually the most common corneal dystrophy in the U.S.
wow.
And it often shows up in teenagers and young adults, which is something to definitely be aware of.
And what's interesting about this one is that it's not just about a single layer malfunctioning. It's about the entire shape of the cornea changing, right?
Exactly. Exactly.
Okay.
So instead of that nice round dome shape in keratoconus, the cornea progressively thins and bulges outward, becoming more cone-like over time.
Huh. Interesting. So instead of like focusing light correctly, it's almost like the eye is projecting a distorted image onto the back of the eye.
Yeah, that's a really good way to put it.
Is it?
Yeah, keratoconus can cause like blurry or distorted vision, so things like straight lines might look wavy.
Oh, wow.
Some people even get halos around lights, especially at night.
I bet, especially at night. Yeah, that must be disorienting for driving especially.
No, definitely.
We've covered a lot of ground here. We talked about the different layers of the cornea, those three main categories of dystrophies: anterior, stromal, and posterior.
We did.
And we kind of dug a little deeper into Fuchs' dystrophy and keratoconus since those stood out in the research you sent me. But, knowing what is only half the battle here, right?
Right.
What does it actually mean to live with a corneal dystrophy?
Yeah, that's an important point.
Yeah.
And the experience can actually vary quite a bit.
Really?
Yeah, some people with corneal dystrophies might not even realize they have it at first because the early stages can be, like, symptom-free.
Oh, wow.
Others might notice a gradual blurring of their vision, maybe those halos around lights we talked about, or have trouble seeing clearly at night.
Yeah.
It really depends on, the specific type and how it's progressing.
So someone could have it and just not even know.
Exactly.
That seems like it would make early diagnosis kind of tricky.
Absolutely. And that's why those regular eye exams are so important.
Yeah.
Especially for anyone with a family history of corneal dystrophies.
Right.
Because catching it early can make a huge difference in terms of managing it.
That makes sense. Another thing that stood out to me in the research that you sent over is that these conditions are genetic.
Right.
What does that mean for someone who might be concerned about passing this on to their children?
That's a great question. And it's something that I think a lot of people think about.
Yeah.
And I think the most important thing is that, knowledge is power, right?
You're right.
Knowing that corneal dystrophies are genetic lets families make informed decisions. That could be anything from family planning to getting kids screened early or just having a sense of preparedness for the future.
Right, being proactive.
Exactly. Exactly.
Okay, so we talked about the different tops, the symptoms, the genetic component, but what about treatment? What can be done to help the people who are living with this?
So the good news is that there's a lot of hope. And treatment really depends on the type of dystrophy and how far along it's progressed.
Sure.
For some people, something as simple as prescription eye drops or specialized contact lenses can make a huge difference.
So those kind of like everyday things that we take for granted can actually play a huge role.
Exactly. But for more advanced cases, there are definitely other options.
Like what?
Well, we've seen amazing advancements in laser treatment, where they can actually reshape the cornea
Wow.
to help it focus light better.
That's amazing. Technology, man.
I know, it's incredible.
It really is.
And then, of course, in the most severe cases, there's always corneal transplant surgery,
Okay.
which involves replacing the damaged cornea with a healthy one from a donor,
Okay.
which can really be life-changing for people.
Right. Giving them a chance to see clearly again.
Exactly.
Sounds like there's like a whole spectrum of treatment possibilities,
Yeah.
but each one is very specifically tailored to each person and their own situation.
Exactly.
That's really good to know. This deep dive has really opened up my eyes, pardon the pun, again, to a condition I knew very little about.
It's amazing how much is going on in there, right?
It really is. Any final thoughts for our listeners out there before we wrap up?
Yeah, I think if there's one thing I want to leave you with, it's this. Even though corneal dystrophies are genetic, research is always evolving.
That's true.
There are new treatments, therapies, even potential cures on the horizon.
Wow.
This is a really exciting field, and I think the future is full of hope.
That's a great note to end on. And to our listener, if you have any concerns about corneal dystrophies or your eye health in general, reach out to your eye care professional because they're truly your best resource for diagnosis, treatment, and personalized guidance. Until next time, keep those brains engaged, and thanks for joining us on this deep dive into corneal dystrophies.